If you think about what's going to happen with inflation, a six-pack of Coke is double the price. And all these costs, we hear milk, we hear paper products and so on. But if you hear these things, it's really going to get you to think like, wait a minute, that is going to have an impact on the hospital. The Americans, the households are spending $175 more now per month for the same items they did previously. How does that $175 example compare to what a hospital is going to increase? It's going to be big. Hospitals need to be proactively prioritizing purchase services because they got to get ahead of all these cost increases. I'd encourage everyone listening to stay ahead of this curve. This curve is not a good curve, and it's prioritizing all of your purchase services because you're going to see the impacts of inflation on service spend.
Welcome to the Healthcare Leadership Experience, a place where healthcare leaders will share proven strategies and innovative approaches to leading the clinical and business side of healthcare. This show is sponsored by Vi Healthcare Consulting, who has proudly helped hospitals save over $700 million in non-labor costs since 1999. Here's your host, Lisa Miller, founder and CEO of Vi Healthcare.
Hi, welcome to the Healthcare Leadership Experience. I'm Lisa Miller. And today we are going to be speaking with Rich Dormer about prioritizing purchase services. This is such an important topic. We happen to talk a lot about purchase services for a lot of reasons, but particularly because of our approach, which is line item detail focused. And it's very unique to Vi. We don't look at aggregate data, monthly data. We look at invoice granular data, and we have patented technology that allows us to extract those invoice details and to analyze and benchmark and put together a cost savings opportunity by line item detail, fully automated. So we love this topic because our clients are achieving results that they can't achieve anywhere else just by the nature of our approach, which again is invoice line item detail level, the same as you would do for any other spend because you would have that on the PO detail report. So today we're going to talk about why you should prioritize purchase services. So Rich, welcome. So my first question to you is, why do healthcare executives need to prioritize purchase services now more than ever?
Thank you for having me on, Lisa. And with my role as Chief Operating Officer at Vi Healthcare, I work with, as you know, all the projects and initiatives with each and every one of our clients that we have throughout the country. We see the trends, we see what people are working on. And while there's still cost savings opportunities with physician preference items and med surge items, the greatest area of opportunity still remains with purchase services. The reason is it's more challenging. And it's just like, if the more challenging something is, the more sensitive, the more complex something is, that's going to offer the best opportunity because it's harder to do. It's not clear cut. It's not just one thing. There's multiple layers. There's multiple reasons why, the cost structures and all the things that support it. When we look at three areas of a breakdown of purchase services and why, again, from a challenge standpoint, is the availability of data. So you're looking at running a report on spend for a specific vendor or initiative or type of category. You're not going to get the real line item detail. So a lot of the information is trapped on the invoices. And a lot of times the invoices don't even detail all the costs, and they just have one number on there. So that's one reason why purchase services are very difficult and challenging to work on. The other one is that, and I mentioned before, a lot of them have these complex contracts. So there's bundled rates, there's things that are tied together, there's these gray areas that are in the contracts that are eventually put onto the invoices. And a lot of times it's depending on the volume of invoices, it's hard to match up. And a lot of times people don't even have the contract to actually process the invoices. So that we see a lot of challenges just understanding the contract and understanding where the invoices are and to actually make sure that it's accurate. And then a big part of a lot of the purchase services is that these are outsourced agreements. So a lot of times the hospital health systems are working side by side with representatives from these companies, these vendor partners. So be it physician groups or rev cycle side or support services. So a lot of times it's difficult to question or to negotiate or to push back on certain things within a contract, within invoice, within costs, if it's someone that you're relying on, it's someone that's there day to day, is that you have that relationship you see in the hallway, you see in the lunchroom, you see at all the events that happen. So it's that relationship piece as well that ties a lot of the complexity, the sensitivity around these purchase services. But again, executives need to prioritize looking at this. This is a really big area of opportunity for organizations. I
agree, Rich. And I appreciate that thoughtfulness. And I think the challenge is that most hospitals would say, well, we are looking at purchase services, we are prioritizing. However, I think what happens is that there are certain areas that just don't get looked at. And we talk about prioritizing purchase services. We're talking about every single aspect, layer, department, cost, not just the usual, suspects of hospitality services or, maybe blood services, reference lab. We're talking about every single service you could possibly think of, even to consulting services, even to hourly rates. Such a great area to look at is to look at hourly rates for all different services across the system and, setting some standards around that. Looking at rev cycle, IT, clinical purchase services, outsourced physician services. We're one of the few companies, if really anyone is out there, not just benchmarking outsourced physician agreements, but being able to review those complex P&L statements, being able to, again, benchmark, look at contract compliance, look at rates, and really help a hospital put together a fair agreement, fair for the physicians, those outsourced physician services like ER, radiology, but fair to the hospital. There's a lot of requests for subsidies, and these subsidy requests are going up. But when we dive into those subsidy requests, there's not a lot of foundation to why they should be getting those requests. Some are warranted or a portion, but sometimes, most of the times, to the degree the amount is too excessive, and that's not fair to the hospital either. So I think when we talk about prioritizing, we're saying prioritize everything. Do a suite. Do one complete assessment of all your purchase services. Get a provider that can help you with all aspects. You don't want 10 people looking at different departments, but have somebody who has complete expertise. So I agree on that. And if you think about what's going to happen with inflation, I wanted to have these numbers for this podcast today. I didn't have a moment to do the research because I heard it on the radio, but something like a 6-pack of Coke, right, is double the price. And all these costs, we hear milk, we hear paper products and so on. But if you hear these things like potato chips are double, like Pringles or things like that, it's really going to get you to think like, wait a minute, that is going to have an impact on the hospital. The Americans are now, the households are spending $175 more now per month for the same items they did previously. How does that $175 example, how does that weigh or compare to what a hospital is going to increase? So it's going to be big. And so hospitals need to be proactively prioritizing purchase services because they got to get ahead of all these cost increases that probably, a lot of them are legitimate. Again, I think it was Procter & Gamble, I forget who has to budget an additional $2.1 billion into their margin, whether it's logistics, all these different aspects. And guess who's going to pay for that? The consumers have to pay for that. And so how is a hospital going to have to pay for those increases? So those are legitimate. But there are purchase services agreements where those rates are not competitive or things are not being utilized or you can standardize. And I'd encourage everyone listening to stay ahead of this curve. This curve is not a good curve, and it's prioritizing all of your purchase services because you're going to see the impacts of inflation on service spend. So Rich, the next question, what processes need to be put in place to do this?
Great question, Lisa. From a high level standpoint, we need first and foremost a report, a categorization of all the vendors, services, spend for the organization. We break them down to 6 categories, 6 purchase service categories: clinical purchase services, facilities and sports services, finance, HIM, rev cycle, biomed, repair, service and maintenance, IT, telecom, telehealth, and then administrative and HR. So once you have that picture, which a lot of, we see this is very common We've always historically done this for our clients. We come and we get their AP spend report, we categorize their spend, and so we give it back to them. There's some other companies out there that charge for this. We basically do it as part of our setup because it's the first step, right? So then the next step, which is the most important, once you start to see, where do we want to look at, either from a vendor standpoint or a category or initiative standpoint, is we want to look at the invoice details, and we want to compare the invoice details to the contract. Now, this is a big step that a lot of people miss. The second one is those end user conversations. We want to understand what's the history, what's the challenges, what are we not seeing in the data, because they're the ones that are living it day by day. They know all the little issues that are happening, all the little gaps that are in the service, which you wouldn't see in the data. So I think those are two big critical steps that a lot of people miss, because a lot of people go to this next step, which is benchmarking, right? So they go to what's the vendor, what's the benchmarking, and they miss this whole invoice to contract comparison analysis, and then also that end user feedback, because it's so critical when dealing with some of these complex purchase services. So once we have that benchmarking, we have the end users, we have that match, we have the real picture of what's going on, then we develop a plan, and we work with the end users, we work with the different stakeholders in the client, and then we engage the representatives. And I think previous podcast, I think it was number 22, we talk a lot about negotiations. So there's a lot of strategies around it, but you build those strategies based on just historically what has happened. Where is the service is headed? What is the issues? What do we want to work on? All of that is put together prior to engaging the vendors. So that's a big piece of this as well. And then obviously getting this in place, negotiating a good contract, a lot of people end there. But really this last step is really important, is a new contract is making sure that the invoices are correct, that they're charging the correct, because I can't tell you how much, and you've seen it as well, where you look back in 6 months and they're not charging their end. There's a lot of spend off contract. There's a lot of things that are not going what they're supposed to be doing. So I think there's a lot of cost savings that's lost because, that contract, while executed, is not matching what the invoices are.
So the next area I want to talk about are some modern strategies for CFOs to consider right now. And I'm going to start this off. I know, Rich, you've got an answer to this, but some modern strategies. We talk about strategic sourcing, which is great, so important. But a modern strategy is strategic monitoring and measuring of purchase services agreements. While we source and we get great deals, we put the agreement in our contract management system, and we wait for the renewals, or maybe there's some quarterly business reviews or, things that happen in between. There isn't this strategic measuring and monitoring process. And that's a modern strategy. You would want to monitor things that are your highest cost items, because those are the keys to either a greater margin or a lesser margin, right? So those things that cost you the most by line item detail, not by the month or the annual spend, but there are things that are embedded in these service agreements that need to be monitored, because if overutilized or there's another issue, you want to capture them before they become, a detriment to your margin. So a modern strategy, number one, is strategic measuring, monitoring, management. I like monitoring and measuring better because it's very specific to looking at key areas of spend, key metrics. And that's the number one modern strategy a CFO needs to consider. The second one is the fact that CFOs need to know that the invoice line item details on their purchase services spend does not get into the ERP system. All that goes into the ERP system is the total invoice amount and some header data. So the only way for the organization, anyone in the department or supply chain or ops, to understand truly what's going on is that they have to pull those invoices manually. You just can't pull the contract, because the contract more than likely doesn't have everything that's actually being utilized. And there's other things that could be going on in the invoices. So CFOs, a modern strategy is asking your organization, people who oversee purchase services spend, how do they get access to line item details? We have so many conversations with people throughout different hospitals and departments that say, I don't get the invoices, or I get a summary of it and I have to approve the summary, or if it's plus or minus 10%, I approve it. And so, a modern strategy for a CFO is, how am I getting my leaders, those in charge of the spend and P&L and budgets, how am I getting them the line item details? And so for us, we extract those details from the invoices and we give those details to our clients, those leaders, department leaders. And, that's a number two modern strategy, that I think are 1 and 2. Rich, I know you've got a few of your own.
I'll add one more. And you mentioned the physician agreements. So outsourced physician groups, one way to really get the transparency is have a list, right? And we're working on this with a couple of our larger health systems where they've asked for what is the vendor, what's the services that are being provided, be it anesthesiology or emergency medicine or hospitalists, and let me know what is the subsidy that I'm paying. And the reason for the subsidy is many times it's when you're looking at the net patient revenue is the core reason why they're asking for a subsidy. We don't get enough money in to pay for our staff. So understanding that subsidy just alone will give you an idea from pathology services to CRNAs. You will know throughout your whole entire organization, what are you paying for these subsidies? And then you can continuously look at this every year. Every year it needs to be looked at. Every year there needs to be a review of the net patient revenue. It needs to be looked at what is the professional services from a competitive salary standpoint. And every year that needs to be looked at because there are these shifts annually within the physician payment, within the physician net revenues that will influence that subsidy. And a lot of times people put a subsidy in place, years go on, they look at it in 5 or 6 years, and they're paying 20% above the market.
That's a really great modern strategy is every single one of your outsourced physician agreements that needs to be in one document. It could be a spreadsheet, and how those payment structures are put together, when the agreement was last signed, when it's come due, when was the last review. In actuality, even for compliance, now those agreements have to be reviewed annually and benchmarked and reviewed. So from a compliance aspect, it's a modern strategy, but also a compliance strategy to go through that. And we're seeing more hospitals pay attention to that. So that's a great addition. As we wrap up, Rich, what are the 2 top areas of focus related to purchase services that every healthcare executive needs to be mindful of as we go into 2022?
No, it's a great question. You mentioned earlier the costs increasing and just inflation, coupled on last year with all the PPE costs and all of the elective procedures being delayed or suspended. It was a tight margins and a lot of people were in the red last year. But like you said, with the inflation and all these costs happening, and one of the ones you didn't mention that we've talked about a bunch of times is outsourced staffing, right? Just getting nurses in there, travel. So, and just to give you an example, and I wrote this down, was a med surg nurse 2 years ago, hourly rate would be $65 an hour. They're right now at $142 an hour. So just give you an idea of what has happened over the last couple of years from obviously with COVID, but the staffing levels, the need for it, right? And now we're even getting it, depending on the state, these state mandates for getting vaccines, that it's going to impact more on the staffing level as well. So that's a huge piece. So I think when we look at the cost, we have to look at what can be shifted on the other. And again, we talked about physician agreements, but there are other sacred cows that really in the organization need to look at. And one other piece too, which we've seen a lot of, is that when we think technology, we think of IT, we think of Citrix and emails and making sure they're secure. But a lot of the purchase services technology we're seeing are really falling outside of that traditional IT. So clinical purchase services, even facilities and support services, especially within finance. So it's important to really understand and bring in the IT team or representatives or a consultant that really knows how these are impacting the bottom line, because one area that we see a tremendous growth in is professional services on the IT side. So someone might negotiate a good deal with the hardware, and when the contract's implemented, they're wondering why they're 20, 30% over budget. It's because professional services were never looked at. So the hourly rate of the people that are helping implement and then support, and that's a big piece that I think a lot of people miss. We've seen it miss. This is not just COVID related. This is not just the last couple of years, but because the accelerated growth of technology within all aspects of the healthcare system, this is becoming more and more of an issue. So I think that's a real big piece that people need to take an eye on. And every contract that comes through, we need to understand what's the technology, what's the impact, how do we look at this, how do we safeguard against it? Because not only from a professional service, but we also see that traditionally IT, they overspec, right? They say, here is your this is your current state. This is what you're expected to grow to. So we're going to put this proposal on this contract based on what you're expected to grow to. And the traditional core IT folks would look at that, and they've, some really sharp skilled are negotiating that. But when you start to look at other areas of the organization that's not used to dealing with it, some clinical purchase service, the CNO is dealing with a company that's dealing on this on the technology side. They don't know the nuances of this, and they don't see it impacted the bottom line. So that's really a big area that we're seeing that needs to be focused on as well.
The financial clauses section of a purchase service agreement is probably one of the least known, least talked about, least analyzed part of purchase services agreements. Invoice data, line of detail is key, but these financial clauses really become a massive problem for hospitals. So we've seen all kinds of financial clauses, even clauses that say, we won't sell to your competitors, but to do that, we're going to charge you several $100,000 a year not to sell to your competitors. And that's really price prohibitive. But what happens is it gets embedded in the contract. And if you don't send in a notice, then it automatically activates. And that's really a problem. Interesting about the med-surg nurse, we were having a conversation, I don't know if you remember, with Brian, and he was saying that AMN stock, because their staffing company has skyrocketed. I think their stock is doubled. They're paying dividends now. They're, staffing company. And he had mentioned how that changed before COVID and then now through COVID and the stock has soared. That's an indicator of what you said is a $65 med-surg nurse going to $142 an hour. But there's still things that hospitals can do. They just don't have to accept that. There's strategies to deploy. So, Rich, thank you. I have started to wrap up our book on the topic. Now, we're tackling this from a couple different angles. I have my own purchase services book, and we're also bringing in a few people from Vi to have a supplemental edition. But the reason why I decided to write a book on purchase services is just there's a lot of information out there that's really not getting to the CFOs. Like, for instance, the invoice line item details. Like, for instance, because we have a dashboard, we bought a dashboard, companies who say they can do this work and who've been brought on to do this work, but yet they only can do partial of the work and they can't do a lot more of the real complex areas, or just frankly, the bad advice that's being given. And we've seen a lot of bad advice. Ratio benchmarking is bad advice. Taking your purchase services spend for a given category, dividing it by the number of beds or outpatient visits, and comparing to another hospital is bed size to that purchase service spend is bad advice. And unfortunately, that advice is going up to the C-suite and it's harmful. What's happening is either that they're not obtainable search cost savings opportunities, or they are cost savings opportunities, but are being missed because somehow or another that ratio benchmarking has shown there's no opportunity. So I wrote this book because I am so frustrated with all of the bad advice and approaches that are being given, and the hospitals think that they have reviewed these areas, and yet we come in and we see it completely differently, and we're uncovering more opportunities in those areas that were previously looked at, and then all these areas that never were looked at, never thought to look at. I'll give you one example is the patient information, right? It's called request for information. And so that's a service that usually gets outsourced. So when either a patient requests information or it could be a doctor or a lawyer, there's a charge for that. But usually how it works is that there could be a revenue share. Maybe it doesn't show up high on AP spend, but this request for information service is a fantastic area to look at, benchmark, analyze, look at the profitability and the structure. And yet, we're bringing this a new opportunity to our hospitals. And they're like, well, we never thought about that. And there's lots of areas where hospitals may be thinking, they've never looked at this. This is probably a good area to look at. So that's why I wrote the book. Thank you, Rich, for being here. And I encourage everyone to listen to our previous show about healthcare analytics and our next episode on healthcare supply chain. And that will be with Brian Covert from our team. So we've got other episodes on purchase services in the beginning of our podcast. I believe it's episode 3 or 4. I welcome you to listen to those. And if you have any feedback, suggestions, or people who you would like to have on the show, please let me know. Thank you, everyone. Look forward to our next discussion.
Hi, this is Leah. You are listening to my mom's podcast, The Healthcare Leadership Experience.
Hi, this is Fernando. If you would like to speak with my mom, just email her.